Hi, welcome back. I'm currently balancing my phone on a computer, so today I wanted to kind of talk about something a little more on the serious side. These videos are not gonna be like fun, I guess, but I wanted to talk about some of the frequently asked questions about coronavirus. So I went through the CDC's website and went through all of their frequently asked questions. Some of them I didn't want to answer in this video. I'll explain why later, but some of it I thought was interesting, and I feel like a lot of people aren't really sure exactly what the virus is or what it does. And you know, basically how it originated and all this kinds of stuff. So I have everything written on a document. What is a novel coronavirus? So that's basically what this is a novel coronavirus. And it just means that this is a new and unidentified coronavirus. The specific strand, known as COVID-19, has never been seen in human beings before, which means that it has to be treated differently than other viruses, specifically coronaviruses. What is the difference between COVID-19 and already known coronaviruses? Since coronavirus is a strand of several different viruses, there are different types. According to the CDC, the common types of coronavirus are 229E, NL63, OC43. I'm currently editing and I'm watching myself butcher this. HQU1. It is HKU1. Moving on. These do not have the same diagnostics as COVID-19. COVID-19 was originally referred to as the 2019 coronavirus or 2019 nCoV. The CO in COVID stands for corona, VI stands for virus, and D stands for disease. The name was created from the World Health Organization, also known as WHO. What is the source for this virus? The exact source of the virus is unknown, but there have been several speculations. The CDC has confirmed that there are other coronaviruses that are common in humans, as well as animals such as cattle, camels, cats, and bats. It is rare for animal coronaviruses to infect people, which then leads to a spread of the infection. As the majority of the public is already aware, many cases of patients with this virus started in Wuhan, Hubei province, China. It was originally assumed that there was some sort of animal-to-person spread due to some link of large seafood and live animal markets. I'm sure many of you have heard the man who ate a bat, and that's why we're all here. I've seen it on Instagram, I've seen it on TikTok, I've seen it on Twitter. Anyway, continuing on. Following this, patients reported that they did not have exposure to any sort of animal markets, which then turned the focus to areas outside of Hubei and in other countries outside China, including the United States. The person-to-person spread was reported in these areas. How it was exposed is still unknown. I've been looking at the CDC website for about 2 days now since I gathered this information, and all of this is still up to date. They have not found the source for the virus yet, but they basically eliminated the belief that it was due to animal to person. What are the symptoms of COVID-19? The CDC provides a list of symptoms which have coughing and shortness of breath as the top 2 symptoms. The following list includes fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. The list is not inclusive, so it is possible to show other signs such as diarrhea, nausea, and vomiting. There is also a list of emergency warning signs that the CDC has shared, which includes trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. That list is also not inclusive, and it is recommended to contact your medical provider if any other symptoms are severe or concerning. Call 911 or your local emergency facility and tell them you are seeking care for yourself and someone else who is showing the symptoms. How does the virus spread? The virus spreads from person to person but specifically when someone is symptomatic, which is when someone is the most contagious. The CDC has said so far that there is no evidence that shows that you can get the virus from food, and while it is possible to touch the same container that an infected person touched, you will only get the virus if you touch your face. Most containers are not survivable for a virus, so it is rare to be infected that way. What is the difference between cleaning and disinfecting? Cleaning removes dirt, germs, and other bacteria on the surface, which lowers the chance of infection, but disinfecting surfaces kills the germs and bacteria, which lowers the chance of the infection even more. How long does the virus last on a surface? The virus's life depends on the type of surface it's on. According to the Cleveland Clinic, the virus can last up to 5 days on glass, 4 days on wood, 3 days on plastic and stainless steel, 24 hours on cardboard, and 4 hours on copper surfaces. According to the Harvard Medical School website, the virus can live in the air for up to 3 hours before the fall, but research suggests that they fall more quickly. So what should you do in the event that you become sick? There are multiple types of illnesses spreading like the common cold and the flu, but if you show symptoms of COVID-19, the CDC suggests that you remain in your house unless you need medical care. Isolate yourself from people in your house and monitor your symptoms. You need to call ahead before you see your doctor, and when you go for an office visit, it is crucial to wear a mask. Also, remember to cover your coughs and sneezes. Just like someone in good health, it is still important to wash your hands often for at least 20 seconds. You should avoid sharing household items with other people and make sure to wash them thoroughly. Cleaning and disinfecting your room and high-touch surfaces in your house should be done with gloves and should be done every day. Many of you already know the precautions that you should take because you've probably seen it on every single social media platform. But I'm just going to go through the list of what the CDC says. So, what precautions should you take? The first thing you should do is understand how the virus spreads, which we already covered, so you're already prepared for that. The CDC has a list of recommendations that everyone should take, infected or not. This list includes washing your hands often for 20 seconds. If you cannot wash your hands, use a hand sanitizer that has at least 60% alcohol. If you have dirty hands, avoid touching your face. Avoiding close contact is the second recommendation, which is why the CDC and other health organizations have implemented a minimum distance of 6 feet between people, especially for those outside of the people living in your home. It is now recommended that everyone, including those who are not infected, to wear some sort of mask or mouth coverage that is made of cloth material. The CDC asks people to avoid wearing masks meant for a healthcare worker, so wearing something like a bandana is sufficient. Although it is information you already know, covering coughs and sneezes are incredibly important and can lessen the chance of your germs coating other surfaces. It is also crucial to clean and disinfect surfaces, as the virus can live on surfaces for a long period of time. There are so many more questions that I could answer, but if you have a question, please hold on to it because I will be doing a Q&A later in the series. Literally just, if you have any sort of question, just feel free to ask. I will drop my social media below, and you can, if you go on my Instagram, I will be doing a poll probably a day or two before the actual video, so that way I have time to research and answer all the questions. With that being said, I need to stop looking at myself. With that being said, I hope you guys have a great day, and I hope this information was helpful and kind of cleared up any speculations that you were having. If you enjoyed this, hit the like button and hit the subscribe button. I do have more videos in store, so see you next time.